Welcome to RSCH503, Research Methods in Biostatistics, a 3-credit graduate course offered by Drexel University College of Nursing and Health Professions. The process of interpretation of evidence from data analysis includes careful examination and organization of data. Data findings must be given meaning. The statistical significance and clinical importance of data findings must be assessed with an eye toward both implications for practice and directions for future research. An investigator does not rush toward interpretation. Rather, the investigator must think creatively about the findings, seeking meaning of findings and trends. The first step in interpretation is considering the evidence that supports or contradicts the validity of the study's findings related to the research purpose and objectives, questions, or hypotheses. The investigator must examine the evidence concerning the study's validity. What were the strengths and limitations of the research plan? Was the research plan logical? Was the measurement plan strong? Did the instruments used to operationally define the variables have solid reliability and validity? Were the instruments conceptually appropriate for use in the study? Was the data collection process strong? Was the sample size adequate? Were enough subgroups included? Were variables measured consistently? Was the data checked once it was entered to note any data entry errors? Were the appropriate statistical analyses used? Were the statistical analyses interpreted correctly? What is the statistical significance of the data findings? Were the results as predicted? Were there non-significant findings? If so, what can be learned from them? Were there unexpected findings? Were the study's findings consistent with findings from previous similar studies? In interpreting evidence, an investigator must fully explore data analysis results in terms of statistical significance. Statistically significant findings supporting the study's prediction or predictions provide validation of the proposed logical links among the study's elements. Unexpected, non-statistically significant findings are very important additions to a discipline's body of knowledge. The same is true of statistically significant findings that were not predicted. Such findings in a valid study also add to a body of knowledge. If a study's results are mixed, one might ask if further research is warranted. Truly unexpected results or serendipitous findings also require further investigation. Statistical results in a study provide evidence. Understanding the findings of a study requires evaluating the evidence and translating results for practical purposes. Investigators often discuss statistical findings with colleagues, mentors, and other researchers to fully explore meanings of findings and to expand implications of research findings. Forming conclusions in research studies is a thoughtful process. Conclusions are derived from data analyses findings and are a synthesis of findings. Remember that research never proves anything. Rather, research offers support for a position. Forming causal statements is risky. It is more credible to state conclusion in the form of conditional probabilities that are qualified. For example, if A occurred, then B occurred under conditions of X, Y, and Z. Or, if A occurred, then B had an 80% probability of occurring. Once completed, an investigator reviews a study's strengths and limitations. Recall that research limitations are restrictions or problems in a study that may decrease the generalizability of the findings. Limitations diminish the external validity of the findings. Theoretical limitations are weaknesses in a study framework and/or conceptual and operational definitions of variables that also restrict the abstract generalization of the findings. Generalization of a study's findings extends the implications of the findings from the sample studied to the larger target population of interest. Recall that generalization is risky if the sample was small, homogeneous, and not randomly selected. Empirical generalizations are based on accumulated evidence from many studies. Such generalizations are important for verifying theoretical statements or developing new theories. Researchers need to ponder carefully the implications of a study for their field. Implications of research findings for nursing are the meanings of the conclusions for the body of nursing knowledge, theory, and practice. A clinically important study should result in altered decisions or actions by nurses that improve patient and family outcomes. Study implications provide specific suggestions for implementing findings in practice. Finally, once a study is completed, the investigator needs to determine recommendations for future research. Future studies emerge from completed studies. Common recommendations include 1. Replicate the present study. 2. Replicate the present study with modification, for example, a different or large sample. 3. Replicate the present study with limitations removed. 4. Replicate the present study with one or more new hypotheses. And 5. Replicate the present study with a revised study design and methodology. This presentation was prepared for graduate nursing students at Drexel University College of Nursing and Health Professions. The primary book used in this research course is The Practice of Nursing Research, Appraisal, Synthesis, and Generation of Evidence, 2017 edition, by Jennifer R. Gray, Susan K. Grove, and Suzanne Sutherland. This book is published by Elsevier Saunders, St. Louis, Missouri.